The Dentalpreneur Podcast. Okay, doctor, it's time to put down that handpiece. You're listening to the show dedicated to helping dentists get their lives back. It's time to decrease your stress, increase your profitability, and regain your passion. Now introducing your host, Dr. Mark Costas.
Hello, everyone. Welcome to another episode of the Dentalpreneur Podcast. I'm your host, Dr. Mark Costas. Hey, guys, what's happening? This is going to be a quick one, and it's going to be a heavy-hitting episode because we have with us today none other than my great friend, Dr. Summer Kassmel, DSI coach, incredible entrepreneur, and host of the Lady Leader series inside the Dental Success Network, not just for ladies, but for anybody that wants to improve their leadership, their dealing with humans, their any kind of practice management challenge you could have. Summer and her experts have covered in detail in the Lady Leader series. Really, really, really good stuff in there. Summer, how you doing today?
I am good. I don't know about you. I had one of those days where I may have too tightly packed stuff in.
Yes.
And so
Yes.
I'm excited that I get to end the day hanging out with you because I really do love just getting to chat about stuff. It's super fun. So it's a good way to end the day, but I'm a little bit, one of those days where it's just too much packed in.
Yes, I am very well aware. I have a Zoom set up in one room, and then I'm in the podcast studio right now with you, and I've been walking back and forth. I go to the very end of one appointment and walk right into another appointment. And this is the 5th hour in a row that I've done this. But as you said, great way to finish the day. I'm going to feel energized and not tired because I get to talk to my awesome friend, Summer. You came up with some really, really cool topics to talk about today. And you asked in a very respectful yet funny manner if I had even read the email that you sent to me over topics that we were going to cover today. And I indeed did. During one of my 90-second breaks. I clicked on it and I read it and I found it very, very relevant to a great podcast episode. So why don't you tell us what we're going to be talking about today, Summer?
Well, so what's funny is I have recently been given myself some potentially just maybe not awesome advice when it comes to running a dental practice. And what's funny is I was receiving this information from somebody who will stay unnamed. My head was thinking, I don't think this is actually logical or makes sense. And so I thought, what a funny topic to cover of potentially whether it be, bad advice or even just kind of irrelevant advice or advice that potentially is a huge generalization that people take as gospel. So I thought it'd be a fun topic to cover of bad, irrelevant, or not helpful advice we've received.
I love that. This is so good. Yes. And I'm sure some of this stuff is advice I've been given and some advice that I have personally given to other people. So, we evolve quite a bit in our philosophies and our views. I remember early in my career, I was so, after I had been burned and let my overhead get out of control for a period of time in several of my practices, I became very, very focused on controlling overhead at the expense of a lot of other things, right? And now I've completely changed that philosophy. I was like, no redundancy, minimal staff, minimal square footage for a practice, no debt at all. I was very much like the Dave Ramsey of dentistry early in my career, but I've realized that you have to loosen that up a little bit. Redundancy is really, really important. You have to have people that, are in your practice that can take over and are cross-trained. And if somebody goes down or somebody quits or somebody gets a job transfer, redundancy is really important. And sometimes you're going to have to take a hit in the payroll percentage, but that's worth it because you can produce more dentistry and you have redundancy and you're less vulnerable. Same thing goes for multiple providers in a practice, which I used to think wasn't as important as I do now. So I've had a lot of philosophical changes in the way that I look at dental practices and the way that I view the quote unquote freedom practice, et cetera. So I've changed my tune in to a large degree in a lot of different things. And I think that anybody that has been in this game long enough has changed philosophies and maybe have given advice or accepted advice that is no longer relevant. So I can't wait for this discussion.
Yeah, 100%. I couldn't agree more. There's advice that I gave even when I first became a coach that I kind of wince at. I cringe at potentially what I may have said just because, the longer you do it, and then really it depends so much on the economic climate. It depends on, what's happening social sentiment wise, that you sometimes have to change how you operate a dental practice. And I think if we have too much rigidity around this is how it has to be, we just don't leave ourselves open to coming up with more creative, ideas. And one of them that honestly I didn't have on here, but I couldn't agree with you more is I too, my pendulum used to be so hard to the absolutely everything has to be systemized down to the T. And I would spend so much time having it almost over systematized that people couldn't have any sense of wiggle room for creativity or putting their own magic into something. And so now I've, tried to figure out how simple can I keep it, but have it be as reproducible for the same result as possible.
Yes.
And the more I kind of got some wiggle room in there, the more actually I saw people rise up with way better ideas than I ever had, or more creativity, or they felt like almost there was that room and space to bring, their personality into it. So that's one that I too have, maybe my pendulum has swung just a bit more closer to neutral. I still think systems are truly incredible and so valuable when it comes to creating the same results, over and over for our patients. But to get too rigid and too systemized can sometimes choke out creativity.
Oh my God, I couldn't agree more. I mean, the magic to a truly good, I think, patient customer experience in general, like if anything is overly scripted or overly systemized, like it may be efficient and it may be predictable, but it does lose the magic of human beings, right? The variation that keeps things interesting. When you're looking at like a McDonald's and you have the vast majority of people that work at McDonald's are like 16 to 18 years old, and it's not their permanent career. And, you're taking people with zero work experience ever. It's really important to keep things as like rigid and inflexible as possible. There's a reason for that, because it's all about consistency. You want your hamburger in New Orleans to taste the same as your hamburger in Tucson, Arizona, right? So I get that. But when it comes to a human dependent industry like dentistry is, healthcare in general, you have to allow for a little bit of creativity and to allow that magic in individual human beings to come out. And I think that that is really what makes a really great patient experience, as far as I'm concerned.
Yeah.
Yeah.
Well, plus you want them to have the resilience and agility to be able to, what happens if something starts going off script? Not everything is going to follow exactly script. So you want to actually hire and create and onboard people to be able to figure out more so, how do I become resilient in this situation? Now I can use that resilience to ultimately, potentially create a better system if it's needed. But ideally I would want them to learn how to be resilient and, agile versus what do I do if it's off script?
So true. It is so true. The ability to improvise really shows a true expertise in an area, right? And you see that all the time with like, in sports and like football, for instance. Like if a play is broken, sometimes the best plays come from broken plays. Like, there's a little bit of a bobble at the line of scrimmage and the quarterback rolls right instead of left. And sometimes magic happens when there's, a little bit of improvisation. And the greats really are the ones that can improvise under pressure and know their topic and know their job so well that improvisation is no big deal after a while. But you can still, fall back on the basic systems and frameworks that are, created for a reason.
Yeah, absolutely. Absolutely. Well, one of the other ones that I wanted to discuss was, I know that a lot of dental students love to listen to the podcast. And I was thinking back to some of the advice that I had gotten in dental school. And then I actually asked one of my newer doctors who I just love him so much. I said, like, tell me, like, what's some bad advice you had gotten? And he said, I was told to make my temporaries absolutely perfect, stain them, glaze them. And he said, just in general, like everything had to be perfect. And it took so long. And I was thinking to myself, in private practice, how that model, we all shoot sometimes for perfection to the point where it's so unattainable, and then it becomes actually inefficient, and talk about not maintaining overhead. So learning how to take that concept of wanting things to be so great and knowing when to say when, knowing when the standard of care has been met and really there's not much more you can do. I thought that was a good one that he had. And for dental students who are thinking that right now, I'm not saying come out and do terrible work. I'm saying sometimes perfection is just not attainable.
Oh my gosh. That's such a good one. I mean, a lot of people aren't placing temporaries now if you have a mill or a CEREC in your practice, but that is such a good one. Like, what's practical in dental school is not always practical in real life, right? So believe it or not, guys, you have to see more than one patient every 3 hours. And you guys know this. I'm not trying to sound condescending, but some of the advice that we're given by faculty probably isn't intended for real world. It is trying to develop your hand skills and to get you to have a very distinctive eye when it comes to, okay, this looks good. This is acceptable for a patient to walk out the door, but not always practical 100% for real life. So, I mean, we don't have to beat this one to death, but that's a really good example. Yeah.
Yeah, for sure. Well, and another one that I had heard is a lot of times, whether it be in dental school or from social circles, things like that, they always have, they say to come out of dental school asking for the highest daily guarantee.
Oh, that's a good one.
Here's what all the things you should ask for. And I always, when I get the chance to talk to dental students, I say, if you choose the right office with the right culture, the right environment, systems, things like that, here's the cool thing, the money really will just come.
Mm-hmm.
And so I'm not saying to throw that advice completely out of the window, but it has some sense of relevancy, some not, in my opinion. Because I think often you may have an incredible offer from an office that's going to give you slightly less, but their atmosphere is so much more conducive to you ultimately having a way better momentum long-term, producing more in a better type of environment with better mentorship and better people around you.
Oh my gosh, this is a really, really good one. And you covered all the right things, right? Like culture, work environment, the humans that you have to work around on a daily basis, that's more important than a daily guarantee. However, if we're looking at things from just a dollar and cents perspective, if you're like, I have to get $1,000 a day and then I will feel safe, like, okay, if the doctor's willing to do that might be good, but there's so many other factors, as you just alluded to, that you have to look at and consider. But additionally, if you're looking at, say, an opportunity where a practice is getting X number of patients, say it's a single doctor practice right now and they're getting 15 new patients a month and you're asking for a $1,000 guarantee, like if this patient base can't feed you enough dentistry to keep both of you guys busy on a full-time basis, and that owner doctor isn't willing to give up any of his personal production, then that $1,000 a day guarantee isn't going to last more than a couple months because he's going to be losing money, or she's going to be losing money on you every single day, because you still have to generate $3,300 worth of production in order to justify $1,000 a day salary. And if you're producing $1,600, $1,700, $1,800 a day and he's losing, or she is losing money on you every day, this is an unsustainable relationship. What you should be asking is what the patient flow looks like, what type of things are getting referred out versus what are staying in, what is my current, clinical skill set, like my clinical suite involves molar root canal and implant placement and blah, blah, blah. So I can add to this particular practice. And if they have, say, a 30 or 33% percentage that they're paying for my production, I'm going to be making way more than $1,000 in this practice down the street that isn't offering $1,000 guarantee. So there's so many different nuances and questions to ask beyond what the daily guarantee is going to be. And I think you did a good job of covering that.
Yeah, for sure. And like I said, we don't need to beat that one dead either, but I just thought that's one in dental school that I think sometimes, I think it's relevant. I think it just needs to be nuanced a little bit more than that.
Indeed.
Another one that a doctor said to me was he had worked in an office where they had the mentality of, with hiring, just offer more than anybody else and try to get somebody in to fill that position as quickly as possible. Almost the warm body type thing.
But
get somebody
an expensive
in,
warm body.
And then, I'm sorry.
But an expensive warm body, potentially.
Yeah, we both know that. But just get somebody in the position, and then ultimately you may be able to make them great. And it was funny because he noticed that was something that was so different in our organization, where it was the opposite, where we would go without as long as possible until we could find the right person. And I think that's, sometimes advice, because just so you know, that was some of the advice I had gotten from somebody, from a headhunter, was just offer more than anybody in your area and try to pull them from another office. And I was talking to Sydney and Ashley, and I said, absolutely not. Because I said, if they're wanting to come over for that extraordinary amount with me, they're just going to be looking for that in the next position in a couple months.
That's right.
And so, for me, that's not advice that I think in some demographics is necessarily the best advice to give, is either putting a warm body in and trying to make them great, or throwing so much money at people to try to lure them away. I think that can, once again, like you said, bite you in the booty.
Yeah, for sure. I mean, if somebody is super money motivated, that's cool. And there's nothing wrong with that. But if they're willing to kind of jump ship for an extra $3 or $5 an hour, then that leaves you in a really vulnerable position until the next person that comes along, the next DSO or the new dentist in town that is having a hard time finding a support staff and is willing to pay anything because they're desperate. You are just vulnerable to the next person that comes in. So really, again, beating a dead horse, but hiring for culture is the only way to hire. Like, you all are going to spend more time with these people than you're going to spend with your loved ones and than your own family. So there's no reason to settle for somebody that you can't stand or that just is not a good culture fit and won't have your back for the long term, because this is just a temporary fix. So I like your philosophy in that you'll wait until the right person comes along, and you guys will work a little bit harder to fill that person's position until they come along, until the right person comes along. It just makes so much more sense than disrupting the culture and bringing somebody in, training them up. Turnover is extremely expensive. Turnover is actually much more expensive than a vacancy in a key role, if you do the math. So I'm with you. I couldn't agree more.
Well, and on that same point, I know, and I've been in this exact position, so I need to let everybody know, like, I'm in the trenches too. I get it, that sometimes we feel as if that C player, like, what if the next person's worse? And I'm always like, what if the next person's significantly better?
Yeah.
And I will say that every time that I released, that C player, the minute that I could, because I recognize sometimes we have to hold on to people a little bit longer than we want because we need to, just take care of our teams and take care of situations. I get that. But I think when people think maybe this is good as it can get, I always say, like, who's the best team member that you have? The one that you're excited to actually see every day, to your point, the one that makes your life better and happier. Well, you really can build whole teams of people that are more like that. It is possible. You may not be able to have somebody with experience in some of the positions. And Sydney, Ashley, and I just did a whole webinar on, how do you hire and use the resources that are around us in DSN to actually build a better culture with people who don't have experience in dental. And that's honestly what I've had to learn how to do, is I just refuse to pay money to people, day after day, that are constantly making myself unhappy or making the rest of the team unhappy. Because to be honest, I always just feel sad for those people, because don't they want to be someplace where they're totally thriving too? It feels wrong for both sides, in my opinion. So sometimes that advice of, like, just hang on to the C player and keep working at it, maybe this is the best you can get. I'm here to say, you know what? Think of your best player. There's more of them out there.
And there's another side to that coin too. It might be just a little bit more convenient to hang on to somebody that's average, a C player. But if they're disrupting your culture and they're putting at risk your relationship with your A players, and I've seen this happen before, you hang on to a C minus player for a long period of time because you think it's just going to be too hard without them. And then just out of nowhere, your A plus player puts in their notice because this other person has just been making their life miserable for too long. So there is that you have to look out for too. That risk is definitely inherent. It's always there if you let people hang around too long that aren't fit for your organization.
Absolutely. And I always tell people, as the owner, it's our integrity at stake, and I think that's important. The rest of the team is also watching what I do and what I tolerate. And if they're expected to rise to a certain level of standard and somebody else is able to consistently not hit that standard but stays, I just feel as if my integrity is just compromised slightly. So sometimes we have to have the conversation of holding these people on, keeping them on for just a little bit until a transition can occur. But I joke, that's why I always have ads out for all positions almost all the time. We put them out, we take them down for a bit, we put them out, take them down, because nothing makes me feel better than to see a whole bunch of applications. And especially right now, the market's loosening up a bit in many areas. Sometimes it just feels good to know what options actually are out there. Anything else on that, though?
Yeah, I mean, I think that people want to feel safe, especially the people that really contribute to the organization, the leaders within your organization. And I've had this discussion before where I didn't even realize I was doing it by either correcting somebody else's behavior or reprimanding them for disrupting the culture, or a vendor or a patient. And they would pull me aside and say, "Thank you so much for having my back," And a lot of times, if you let somebody stay too long, they feel as though they're not in a safe place and you're not protecting them. You don't value them because you're allowing this to fester in the background. So,
yeah, absolutely.
I mean, you are the leader of the organization, you CEOs out there. It is your job to take the best care of your people. So, enough
for sure.
Enough from me on that. But I love that question. That's a good one.
For sure. So some other advice that I think potentially we've all given or we've all heard, we've all thought was true even, but to grow a practice, and that's such an ambiguous term to say to grow a practice, but sometimes what I've heard is, increased production is the number that matters. That's what matters, is to grow a practice, increased production that's it. And I always say, increased production is potentially part of it. Well, one, what does growth mean in the first place? What are we trying to grow? Because if it's growing profitability, then increased production isn't the only, side to that coin. If we're trying to actually increase what you're taking home, I have people that I coach that the production's gone up, their take home has gone down.
Oh, yeah.
And so I think sometimes when all we're looking at is, has my production gone up? But what we haven't also looked at is my overhead being controlled? Is my efficiencies increasing? Is my service staying the same? I think there's other metrics, that need to be involved in regards to growing a practice when it comes to talking about increased production.
Yeah, this is a great one because, I mean, you go to the ADA meeting or like a major state or regional meeting, and people are pounding their chest saying, "This is how much my practice produces." But when you say, like, what's your EBITDA? What's your overhead percentage in comparison to that, excluding doctor pay, right? Or I'm driving, my main goal this year is a $3 million practice. Well, what does that really mean, right? So where are you as far as percentage of fixed and variable expenses? Like, how much are you actually taking home from that? You and I have seen this a million times. In fact, I have a whole presentation where I have practice A and practice B. Practice A was actually doing like $1.1 million. And incidentally, you were the actual model of the $1.1 million practice when you came on to our group. So you were the ideal. And then there's another practice that was doing like $2.4 million when the $1.1 million practice owner was taking home significantly more, twice as much more home because of their overhead and their efficiencies and their ability to put favorable interest rates together for their debt repayment, et cetera. And the other practice was producing a lot, but there wasn't a whole lot of attention put to like marketing budget and variable expenses and fixed expenses in comparison to, the revenue, and getting in cash flow situations where they're putting like they're just taking out like really high interest loans. So there's so many variables that go along with growth of a practice. Growth for the sake of growth's sake, as far as top line revenue, is not what you should be focusing on as a sophisticated operator.
Yes, absolutely. Everything you said, I couldn't agree with more. Sometimes people are wanting to add. And I always say, honestly, is there any juice left to squeeze with what you have right now?
Yes.
Before we start adding, let's just ensure that there's not inefficiencies, things we're missing, holes in the bucket right now. It's the same with multiple practices and things like that. Sometimes we've both seen it where people are trying to move to 2, 3, 4 practices before really they were ready with that first one. And, more for the sake of more, I've just watched it often overly consume, really well-intending doctors.
Yep.
And so increased production for production's sake, or, I think Tenori and I both say this, but that whole quote about, if you're not growing, you're dying. I think sometimes, once again, I think the message of that quote, I think makes sense, but sometimes people will take that generality and think, if I'm not always expanding my practice, if I'm not always finding, adding more operatories, adding more practices, adding, I'm not growing. And I tell people a lot of times my growth method was actually simplicity. It was doing more with less. How do I do more with less? So that line on Jake's reports that said available funds at the end kept growing. Because for me, I knew top line revenue was only part of the game. And sometimes with that top line revenue, I just was ending up paying more taxes if I wasn't careful.
Yeah.
And so I think we've got to understand more what those metrics means before we just increase revenue. And I always beg of people when they're sitting next to those people at the ADA meetings and things like that, don't get pulled into that stuff. Don't get sucked into the whole, my revenue's 3 million, or we're projected to hit 4 million. You say that's awesome, good for you. And in your head that, you understand these metrics and you very well could be taking home more than they do.
Yeah. And often we see, especially with DSI docs, that often that is the case. That is another philosophical change, or at least another focus and emphasis that we've slightly changed in DSI over the years. And that is growth for growth's sake, without a very clear definition of what growth looks like adding 3 more practices when you have a blue belt level practice and your overhead's hovering between 65 and 68%. Adding a practice or 2 or 3 probably isn't the best idea, because you have so much more opportunity in your primary practice that you need to focus on and figure out and create that prototype that's absolutely perfect. Maximize the growth as much as you can within this one location. And when I'm talking about growth, I'm talking about overhead and systemization and all that stuff. And then if you still feel like the energy to do it and the necessity to do it, then we can start thinking about building a new practice or adding another wing, another 2,000 square feet to your existing practice. Because it goes both ways. You can still be ill prepared for a same location expansion by the same metrics. Maybe you're not sophisticated enough to do an expansion because you're bringing on a ton of debt. So maybe we focus on fixing this thing, maximizing your current capacity, and then we'll talk about expansion. Be that another construction project to the same location or another practice down the street.
Yeah. Because I tell people all the time, I'm a perfect example of, I actually had everything systemized. I had my overhead in the right place. I had even leaders in the practice. So when I started, that second location, I thought I was super ready, and it was still a challenge, even with all of that. So I think when you don't have all of that, it just makes it even more difficult sometimes. So growth for growth's sake, I think, is another one that people often maybe it's just misguided information based on how they perceive that information. And the last one I want to do, because I hear this one a lot, is when they're looking at their numbers and things like that, I'll hear, I was told I just need more new patients. You can never have too many new patients, just more new patients. And to me, that's a lot like what we just discussed, where sometimes I'll look at the number of new patients for 1 or 2 docs and it's already at 80 or, 90. And I say to them, boy, what's the attrition level right now? Are we retaining all these people we're bringing in? Or are we leaking out as many patients that are coming into the practice? Once again, it's very similar to the last subject, where are we doing everything with the patients we've got right now? And this is what I talked about at the last mastermind presentation was, I think once again, there's a lot of juice to squeeze from periodic exams, our recall patients, and making certain we're doing more with less as much as possible. Every exam is gold, I say. And sometimes if we haven't been treating every exam as gold, it feels like we constantly need more new patients. So between attrition and ensuring we're taking care of the patients we have, sometimes we just don't end up needing quite as many new patients as we think.
We see this all the time. This has been such a common theme in my coaching calls and my small group coaching calls and my large group coaching calls and the regionals as well. It's like you see a practice that's got top line of, I don't know, $2.5-3 million, 3 full-time docs, and they're getting about 45 new patients a month, right? Extremely efficient, low overhead. They're doing a lot with this new patient flow. And then you see another practice, just like you kind of alluded to, maybe 2 full-time docs, 90 new patients, and they're struggling to get to $1.5 million, right? So something is happening here that we have to tease apart. Now, what is it? Are they going out the back door, like you're saying? Are they attriting out of the practice very, very quickly? Is there not enough capacity in the office, so they have to put them out 6 months for a restorative procedure, or are they not even able to come in for cleanings on a regular basis? It could be something like that. More common than not, it's no focus on the actual patient experience and the case presentation / diagnosis calibration within the practice, right? So you have one doc that's saying this, and then that's not consistent with the other doctor's philosophy. And then you have a treatment coordinator that is not calibrated language-wise with the doctor that just explained what needs to be done to the patient. So a lot of times it's patient experience, like it's not as good as it can be, and there's no flow and consistency with the case presentations. That's usually what I see as a problem.
Yeah. And I agree. A lot of times it's potentially even just a lack of awareness of what's happening from the moment they come in, meaning, that first point of contact, really, as the owner doctors, we just get so busy that sometimes we forget to really look at from first point of contact to whoever they meet on the way back, what that experience looks like there, what the dollar per exam is, which everybody knows I'm a huge advocate of, really knowing what we're treatment planning per exam. And then when it, like you said, when it goes to the TC, are they afraid to have conversations? Are they afraid to sit and really be that patient's advocate? A lot of times that's what I see also. Yep. So that patient leaves and says, you know what, I'll think about it. And when we look at the treatment acceptance, it's relatively low and nobody's necessarily following up. And so it feels as if a lot of times we just need more new patients, when really it's just we may need to fine tune the process, from first point of contact all the way through to that treatment plan and the follow-up.
Yeah. And what's funny is, and this is going to be my last statement because I know you have to go to a volleyball game, but what's funny is that people don't often want to hear this because this is the basic stuff. And it's like, no, you guys, you don't understand. I need more new patients. It's like, well, you're already getting many more new patients than the average doctor inside DSI. So your marketing is working. What's broken is the basic things. Like, what does the greeting look like when they walk through the doors for the first time? Like, how is your financial policies? Is everybody friendly and happy? And are they shown like a lot of care and empathy when they walk in there? Those are soft skills that don't sound like they're going to solve the problem, but that is actually, in most cases, a big part of the solution. But that's not what people want to hear because it's not sexy. And like, what's easy to hear is I need to increase my marketing budget from $10,000 to $25,000. My marketing company says so. And I just need more new patients. I don't need to treat the patients better when they get here. I just need more of them. But yeah, I think that's short-sighted. Yeah.
I think that's honestly, I couldn't have said that better myself. That's exactly like sometimes I get on coaching calls and I always feel like the bearer of bad news that I'm like, oh man, it always goes back to the basics. Yeah. It goes back to what made us great probably in the beginning, which was focusing on a lot of these things. Yeah. So, what's funny is perhaps, to sum this all up, some of the bad and irrelevant advice is too broad and too, too general. Ambiguous.
Too general. Yeah.
In general.
Yep.
And so I think people sometimes take it and manipulate it to whatever the least path of resistance is and try to just do that.
Yep.
but increased production, more new patients, being perfect with everything, hiring whoever. Just sometimes these generalizations lead us to actually a worse position than a better. And often trying to do more with less and, just really simplifying some of those basics might be just overall better advice.
I agree. This was a great episode, Summer. Thank you so much for taking the time.
Yes.
I know that you had short time today, but that sometimes creates the best episodes. And that was a good one. I really appreciate your time and everything you do for our community and the profession. And I can't wait to see you in a couple weeks in Dallas.
Next week.
Yeah. There's going to be a co-presentation with two heavy hitters, Jason Tenori and Summer Kassmel. Holy cow. I'm very excited. Can't wait.
Yes. We're excited too. I told him, I was like, which one of us is going to be more of a ding dong up there? And I was like, I feel like it's probably going to be me.
Stop it. Oh my gosh. I can't wait. Go have a good night with your family and we'll talk to you soon.
You too.
Okay. Ladies and gentlemen, Dr. Summer Kassmel.